Hello, I'm Dr. Amit Mulay. I am a consultant plastic, reconstructive and aesthetic surgeon practicing in Pune and Pimpri-Chinchwad area. I have my clinic which is named as Deccan Clinic in Connaught Place building in Koregaon Park, and my total surgical experience is around 12 years. So today we are going to talk about breast reconstruction after removal for cancer surgeries. Um, as we all know, there's a notion that breast cancer is a disease of the West, but there is a slight shift in the incidence of breast cancer in India, and it is quite significant. The number of breast cancer patients have already surpassed cervical cancer, and it is currently the most common cause of cancer in Indian women. Uh, so there is lots of new modalities of treatment which are coming in for breast cancer, and as a result of that, the survival after breast cancer has increased. However, when the survival improves, what comes next is the quality of life. According to a WHO study, only 25% of women who undergo surgery for cancer of the breast are aware that they can get a new breast after doing a small surgery, and that is quite depressing. So, today I am going to talk about breast reconstruction after removal for breast cancer. Essentially, there are two kinds of surgeries which women undergo for breast cancer. One is breast conservation surgery, and the other is mastectomy. So, if a patient has undergone breast conservative surgeries, you have techniques which can just replace the volume, and there are techniques where you can do some volume adjustment to get a newer breast. However, once a mastectomy has been done, you need a whole chunk of tissue from other side uh, to replace the breast. So today we are going to talk about this breast reconstruction after mastectomy, and there are essentially two types of breast reconstructions which you can have. One is implant-based reconstruction, and the other is autologous tissue, that is tissue from your own body is taken for reconstruction of the breast. Autologous reconstructions we'll talk about later. First is the implant-based reconstructions. Implants are tissues which are not from your own body. The commonly used implants are silicone implants, and these may be smooth or texture. The most important advantage of implant-based reconstruction is the magnitude of surgery. The duration of surgery is smaller, and the surgeon might not be that skilled to do an implant-based reconstruction. However, there are few major disadvantages of implant-based reconstructions. Implants do not tolerate radiotherapy well. The implants will not age with the patient, so there will not be any sagging of the implants. So there will be asymmetry in both the breasts. And thirdly, the implants have their own life, maybe 10 years, 15 years, and after that, you might have to do another surgery to remove and replace the implant. Autologous breast reconstruction is by far the gold standard for breast reconstruction, and it has got many advantages. The field with autologous breast reconstruction is as good as the normal breast, which is not so with implant-based reconstructions. However, autologous reconstructions have their own disadvantages. There will be additional scars in the body, there would be additional pain, and the duration of surgery and the recovery from surgery would be slightly longer than with implant-based reconstructions. Also, the autologously reconstructed breast will tolerate radiotherapy much better than the implants. Uh, the reconstruction time also differs. You might do the reconstruction immediately following removal of the breast, which is called as early breast reconstruction, or it might be done after completion of therapy. In general, for early breast cancers, early breast reconstructions are indicated. For advanced breast cancers, we generally prefer to complete the chemotherapy, radiotherapy first, and then going for breast reconstructions maybe 6 months down the line. Uh, so after the breasts have been reconstructed, you can also reconstruct the nipple and the areola by doing a small procedure under local anesthesia. The nipple can be reconstructed by using the local tissue itself, and the areola can be recreated by pigmentation and micro tattooing procedures. Uh, Again, breast reconstruction. So, to summarize, breast reconstructions is currently the gold standard, and it has become the standard of care for breast cancer treatment. Uh, Autologous breast reconstructions are gold standard, and they are preferred over implant-based reconstructions. However, implant-based reconstructions still have a role in breast reconstruction, and breast reconstruction is generally a safe, well tolerated procedure. And the most important advantage of undergoing breast reconstruction is that it improves the sexual well being, the psychological well being, and the overall self esteem of the patient.